are some of the most pressing issues that you're seeing in your workforce just around employee well-being?
Navigating so many unknowns. I think the emotional well-being component of wellness ties into that quite a bit.
The whole mental well-being is a real huge concern right now. And I think it's just everything combined. It's the COVID, it's the civil unrest, and now the wildfires.
How do we put more focus around providing resources to our leaders?
I think they've really been looking at ways that they can further their communication and add additional transparency.
In this session, we are discussing the current state of affairs for two organizations into early parts of 2020 when a worldwide pandemic hits, right? And so businesses have had to learn to adjust. Where did you find really resiliency within your organization?
We've had employees, take the initiative. We launched 2 new employee resource groups, one for our working parents and families. And then we've also had, individuals who just stepped up, right? Let's bring the team together in a very intentional way.
Not only has the pandemic changed the world of work, but it also has challenged our working families.
Our talk today on Total Worker Health is focused on the family supportive workplace component of Total Worker Health. It takes that entire ecosystem of parents, managers, partners at home, companies to come up together and navigate this transition towards growth and potential for a better world.
So I really encourage organizations and supervisors and managers to start with what you can do to really connect on a personal level with your employees. And that's when we're able to really collaborate and really get creative.
If people are working in environments where they feel like they can be authentic, they can be themselves, that authenticity is really related to positive job outcomes. So things like job satisfaction. Focus groups, we've done surveys, we've done lots of research to really understand allyship, and that support and advocacy seems to be a really good distinction. Be a shoulder to cry on, you can listen to people's experiences. With advocacy, what we have instead is confront prejudice when it happens. You might try and educate other people or obtain resources or change policies of the organization.
I'm really struck by how sobering some of the data is that you presented.
One thing we heard quite strongly was that many of the professionals and leaders of color who relocated here, and they're actually people who've lived here or were born here, who don't know the depth of the racial divide in Oregon or the Northwest.
What are some of the things and practices that you've seen or you've done at Cambia to help us be better allies?
This concept of allyship and direct action and examining our behaviors and our words continues to be present, in particular for folks in leadership.
I want to thank you for your time and your support. Have a great rest of your day.